Okay, good morning, Dr. Jasmine. Thank you for
Good
taking the
morning.
time to come out and chat with me with your very, very crazy schedule that you have.
I'm excited to be here. Thanks for having me.
Yes, absolutely. I'm so excited to have you on here and for you to share your story with everybody. So let's just start with you telling everybody about yourself and how, you got into airway. I think we all have that aha moment. So if you want to share that, that'd be awesome.
Yeah, my aha moment was a personal aha moment. My shoulder and my ankle were kind of like injured around the same time, or at least that's how I remember it. I slipped and fell in the shower, and I, at the time, was working out 6, 7 days a week. I was just at this peak of physical performance, and very quickly after that injury, I was able to rehabilitate it on my own with my trainer and live life again. And then I moved from Philadelphia at the time where I was in my residency training to North Carolina. So new life, going from seeing 10 kids a day in residency to like 40 kids a day in clinical practice. New place that didn't have a refrigerator or microwave or stove yet. So eating out all of a sudden and new lifestyle, no trainer, no real gym routine established, and within 2 months that ankle that didn't hurt all of a sudden started hurting again, and the swelling had never really gone away. So I decided to see a couple of physical therapists for this ankle, and at the top quality physical therapist. You know how it is when you get out of school and you finally start making money and you're like, I'm gonna get the best
Yep.
therapist. So I get like these top-notch PTs who are working with NFL and NBA athletes,
Oh,
and I think
wow.
I'm really doing something. And after a few months, I'm just not really getting better. Um, my back was hurting as well, and I thought that was because I was working, in a new office, poor ergonomics. So I started going to an amazing chiropractor. His front desk person, who I'm now really great friends with, she said, "Hey, I know this PT. He's a little bit oddball. But since your physical therapy is not going that well for you, you're still limping, you look a mess. Maybe you should consider going to him." And so I thought, oh, he doesn't take insurance. I had the money, but I was like, I don't want to go to this guy. And so, begrudgingly, I go, and in 2 sessions, 100% of my swelling is gone, 100% of my ankle pain totally
Wow.
resolved. And then, like, this guy his name is Mike Vita. I have the pleasure of working with him now, but at that time, he was like, the angel that fell from the sky that
Yep.
helped out my ankle. And so I was like, Mike, my shoulder's been bothering me. Now that my ankle is, resolved, like, work your magic on my shoulder, come on, here we go. And he's like, well, it's not exactly gonna go like that. Let's go back to the beginning and start talking about the foundation of what I do as a PT. So I'm like, whatever Kool-Aid you want me to drink, pour it in a glass and hand it to me. I'm ready. So he starts asking me questions about my teeth. And I'm like, Mike,
I'm a
I'm
dentist.
a dentist, right? Like, what do my teeth have to do with this process? And he's like, how do you breathe? And I'm um, like that? I don't know. What do you mean? And do you dance? Do you have rhythm? And I'm like, what is this stuff? Like, just fix my ankle. And he was the first person that ever took my brain to a space where I had to think about the fact that my mouth had a connection with the rest of my body.
Yep.
And maybe, just maybe, there was something wrong in the connection between my mouth to my chest to my feet. And I thought, oh man, I used to trip all the time as a kid and stumble on stuff. But I played sports and I was super advanced with hand-eye coordination, so no one thought I really had a problem. But I used to trip a lot, and I still do. And he was the first person to kind of say, hey, these things are related. He stuck a cotton ball in my ear, and I immediately walked differently than I did before. He put that cotton ball in my ear,
Wow.
um, and he started talking to me about breathing. And it was my first introduction to airway. And I thought he was crazy. And it took me a few days to really let it all sink in. I
Mhm.
didn't know enough about anything for me to really know anything that he had done. But there was a course coming up where a PT and a dentist were going to actually have a local kind of small time
Oh,
event
wow.
together. And I remember leaving that multi-hour course going, everything, it felt like it was in French.
Yep.
And I was just like, what are these terms? And I just was intrigued. And that was the beginning. That was
Mhm.
my okay, there I do have gut problems and allergy issues and all of these things that I've had over the years that someone has always attributed to something else. And I realized in about 3 months, it seemed like it was overnight, but 3 months is a short period of time, but all of a sudden I realized it's all connected,
Yep.
and that was my start. And as I started to find answers for myself, I realized there are other adults that struggle with this, but more importantly, these signs and symptoms were there early on, and maybe I should take the time to figure out how to see it earlier.
Mhm.
And here we are. So,
And here you are. You're going to talk about it all.
here we
So
are.
so I know that, we had talked earlier and I know you trained with Dr. Raphael. So how did you come across him?
Oh man, what a person. First of
Yep.
all, there are people who are just gems of individuals, and he's just one of them. So, there was a course on tongue ties at his office. I want to say this was the end of 2017, maybe early
Mhm.
2018, but I think it was the end of 2017. And he has a big educational facility. The course didn't have really anything at all to do with him, he was just hosting it.
Mhm.
And at the dinner of that day, we sat beside each other. And he's like, hey, did you mention you have a new office in North Carolina? I'm like, yeah, I have a new office. We serve the community. It's 95% Medicaid. I'm super passionate about it. I see a lot of kids. I'm making a big difference. It's my Chick-fil-A experience on a McDonald's budget. That's my motto at the time. Like, I'm so excited about this. And the next thing he said to me changed the entire course of my career, which was already in my bright, all the stuff with Mike was in the back of my mind, but
Mhm.
it was just kind of like me, it wasn't about the kids just yet.
Mhm.
And he said, North Carolina, yes, I have a few patients here that live there. So I know a little bit about North Carolina. And whatever he said for the next 30 seconds, I didn't hear it because I was trying to figure out if I fully understood that this orthodontist in Clifton, New Jersey had patients that lived in my state 8 hours away.
Mhm.
So after he finished talking, I said, Dr. Barry, I'm so sorry. I think I misheard you. Did you say you had patients who were from North Carolina, like they used to live there, or that they currently live in North Carolina? Oh, no, they currently live there. My life to that point, I didn't understand that people cross states for treatment. And I was like, excuse my ignorance, but what type of orthodontics do you do that I mean, I drove past, I swear, 100 orthodontists on the way here. What do you do that's different? Excuse my ignorance for that question, but like, what do you do? And he's like, oh, have you heard of myofunctional therapy? And I was like, myo, I don't know, am I gonna cuss? What is it again? And he's like, myofunctional therapy. I have no idea what that is. Do you know about myobrace? No. And there were two pediatric dentists at the dinner table as well across from me. And they were, listening in at this point of me, laughing at me totally hearing these new words for the first time. And they were telling me that it was a great way for them to break up the monotony of traditional pediatric dentistry. I had just had my shoulder surgery, not that far past that point, maybe less than a year at that point. And so they're like, hey, dentistry is it's a lot of labor on the body. It's a labor of love, but it is a labor. And really, you should consider MyoBrace as something to give you an opportunity to break it up. Maybe think about it, and that's what we do with it. So I said I got to figure out what this MyoBrace is because they're excited about it, and Dr. Berry is really excited about it and has people traveling 8 hours for it, but I have no idea what it is. So that was my introduction to him, and he was nice enough to say, Chaz, if you want to learn it, I'll teach it to you. And from that day forward, I've been right here, right up under his armpit. Thankfully, it smells good. And he's taken me under his wing and he's taught me so much. I'm forever indebted to that guy because he's taught
No.
me so many things that I've been able to pass on to other providers and parents. And working with him in 2019, he let me come into his office and work with his patients. And I grabbed my New Jersey license as fast as I could when he said, "Hey, you want to come here?" I sure do. And it was a great experience. And so he's just, I mean, he was. You are amazing that you had him on your podcast, and he taught me so many things. So he's awesome.
Yeah, he's such a wealth of knowledge and he explains things so easily, like you get everything he's saying. He doesn't talk over you, he talks to you. And it's just, I totally loved interviewing with him and chatting with him. And he's just a great individual. We're all very, very lucky to have him in this field and everything that he's done for our field. Now that tongue tie course that you went to at his facility, was that Dr. Zagi's course?
No, this was before my Dr. Zagi Breathe Institute
Okay.
experience. This was a course, and it's funny because, I talk with people all the time about courses, just like, people and relationships and appliances and cars. There's good courses and then there's lemons. And I would chalk that course up with a great learning experience because the group was so against branching out with thought. So there was a lot of tension behind the scenes between the organizers of that organization and the speaker. So the speaker was speaking things that he thought to be true research he was understanding, and they were not supportive in him bringing in this new knowledge. And so he actually broke away from that organization. So that was like my first course was kind of like, okay, so there's a lot of strong feelings in
A
this
lot of
space.
controversy.
There's a lot of controversy amongst providers. And so, what I loved about when I finally did have my first Breathe Institute course back in 2018, they don't, like Dr. Barry told you, he doesn't subscribe to like one appliance or one theory. It's there's a why. And how we get to resolving that why can happen any one of hundreds of ways,
Right.
that they're just not my way or the highway. And
Mhm.
one of the things I love about Breathe Institute, Dr. Pinto, Laylee, who drives that whole entire ship, they are so huge into mind open learning new things. So I am a Breathe Institute affiliate, so everything I talk about is a Breathe Institute at this point. But I mean, there's so many great. Dr. Baxter has a great program. There are so many great programs out there. So we really are lucky. And of course, like anything else, there's some programs that are a little bit incomplete, and that's okay because people are trying. So there's nothing wrong with that either. So
Now I know from listening to another interview of yours, excuse me, you yourself, I don't know if you're currently still in myofunctional therapy or you were, but if you want to share, your experience with that as an adult, and then if you want to even share with us, because I know there's a lot of myofunctional therapists that listen to the podcast, what some of your favorite exercises were that you did.
Well, I actually was so into Mayo that I decided to get my certification through. Sandra Colson actually was
Oh my
my
God, I love
teacher.
it. You do all the things.
So I went through the Mayo training with no intention of actually seeing patients, but just because I was so intrigued about, I need to know more. So
Mhm.
shout out to her. Sandy is an amazing human being, and she was patient with me going, okay, so I'm gonna get the certification from you, but I don't want to practice. I just don't want to be nosy. But so I self-taught myself Mile for a while, and then realized I didn't have the accountability necessary to make big changes, and I didn't have the consistency needed to get the results that I wanted. So I needed to get a myofunctional therapist. And so I'm going to leave that person anonymous right now because I'm working on a project with this person.
Ooh.
I've learned a lot. And I can tell you that I have not stuck with it the way that I should, which actually gave me really good insight for a
Mhm.
lot of really busy professionals who have six
Right.
companies like I do, who need to transition from reasons to results. And how can you throw the textbook out the window and really individualize and customize a plan? So, shout out to this particular therapist for really being patient and figuring out how to do that. But yeah, the exercises are so interesting. There's hundreds and hundreds of exercises.
Mhm.
I thought at first they were like, 10 exercises. And then, of course, I had the exposure of MyoBrace through Dr.
Mhm.
Barry, which is, a different style of like a myofunctional training esque
Mhm.
with the cookbook, but with it's like two cookbooks because they have an advanced program with that as well. And then you have the customized myo. So I've seen so much myo to know that it really does, you really do need a therapist for a lot of people who have busy lifestyles and who are
Mhm.
entrepreneurs or go-getters that need it customized around. You can do some in the car or
Yep.
do them when you're in the shower or when you're walking the dog or the little pockets of time that you have
Right.
instead of sitting in front of a mirror and really, that didn't really
Yeah.
work that well for me.
And that's usually one of the first things I go over with my adult patients because it's not going to work. It's not going to reflect well on me if it doesn't work for them because we're not going to see progress. So the first thing we do is talk about, okay, what's your schedule? Like I literally, we're going to write it down. And if you have two different schedules because your weeks alternate, we're going to make two different schedules and we're going to figure out the best time for you to fit it in. And kind of like you said, maybe the exercises you need props for, you do at home and then the ones that we give you that you can do in the car. So I do always try to make sure I give adults some exercises they don't need the stuff in the kit for because they're busy and they have all this other stuff to do. So we have to be obviously realistic, right? You can't just expect a very busy individual to do 8 exercises 3 times a day. It's just not going to happen. And I think you kind of like you said about it being individualized. Just this morning, I had a patient come in. It was her first session. And I still sometimes do a little bit of treatment planning before, but I found that almost always it's almost a waste of my time because I almost always end up diverting and doing something else. And I got to work a little bit early. So I was like, oh, I'm like, all right, let me just think about what exercise I want to start her with. I didn't do any of them because I totally had to change my plan because she couldn't. We had to start so basic for her. And for an adult, you wouldn't always think you have to. If you ask somebody to stick their tongue out, make it skinny, people just assume, oh, yeah, I'm going to be able to do that. And then they try it and it's like their tongue's glued to their lip, their jaw's hanging this way, they're slumped over like this. And it's like, all right, we're starting from the beginning here.
I love that you said that because it really is about starting at a foundation.
Mm-hmm.
And there's I do have the pleasure of having some pretty amazing myofunctional therapists near me that I'm now meeting, and
Yep.
one of them, her name is Toby Freeman. She's amazing. We work together with some patients, and the patients and the parents love her.
No,
But when
that's
we very first met, what she said to me is she breaks down. Oh, Brittany, can you hear me?
yes, I can.
Is my connection good? Okay, I'm making sure my connection was still good. One of the things that Toby said to me when we first met is that she uses an analogy with her families, and I hope I don't mess up her analogy, but she says it's kind of like learning to play soccer.
Mhm.
Everybody's like, I'm gonna get in the game and kick the ball, but actually, it's just you and the ball and the net, and
Mhm.
you spend a lot of time just learning to kick the ball into the net and focusing on the good form and setting a good foundation. Then you transition to your child kicking the ball in the net with their teammates, and they're kind
Mhm.
of like on their team, but they're still not in a competitive game yet.
Right.
They're learning to be around other kids. Now they're moving from one end. Now it's like one net. They're two goals, and now there's all these movements, and then you transition from that to now there's a game and a referee and there's wind and there's an audience. So kids and adults, we're just big kids at this point, transition to performing, on a stage in front of an audience quickly. Some
Mhm.
do, they're always unicorns, but most of us may spend more time than you think just kicking that ball into that goal by ourselves. And I never thought about that. I never thought about when I played basketball. I coached basketball for 15 years,
Mhm.
and I coached all age groups, but I really loved when I did my 9 and under group. And you start with the foundation. You don't just start at the 3-point line. We really
Mhm.
did start with shooting actually the ball right against the wall and getting good form. You never even got to the basketball net or the basketball court. Sometimes you lay on your back and shoot. So I
Mhm.
love that you said you had to start at the foundation with this patient because sometimes as a provider, you get so excited and you learn all these
Yep.
tools, forget that, man, so many of us have decades of dysfunction that really does take a long time to unlearn. And
Yeah.
I love that because I'm that patient. And I'm also the
Yeah.
hard-headed patient who thinks, yeah, I can shortcut the process and
Yep.
I'm going to unicorn this and in 3 weeks I'm going to have it. And then, 3 weeks turns into 3 months, turns into 3 years. And I'm like, if I just followed Brittany's instructions, where would we be? I shouldn't have tried to
And
do
I
this
think,
alone.
we were talking about one of your hygienists earlier. I think for the transition for hygienists, because hygiene's very, you know, you scale, everybody has a system, right? That we scale teeth. We start in one quadrant on the buccals, we go to the linguals of the opposite lower quadrant. We use the 13, 14 for the distals, 11, 12 for mesials, whatever, the whole spiel. We have a very regimented routine. Although every patient's different, it's still, you scale teeth. We know how to scale teeth. We can do it with our eyes closed. So one of the things that I find with our students in our T-Mile course is they want that cookbook way. Like, can you just tell us what you would do? And I'm like, I could tell you what I would do with this patient, but you might get a patient in there that's totally different. And that is why, like, the cookbook recipes, they just don't work. And like, I've taken a bunch of different mile courses and like, I've learned some cookbook ways, not some cookbook ways. I've tested them and like, religious, like I test them, I shouldn't say for fun, but I'll give like an exercise to a patient that I know that they're not going to be ready for, but just to see. And every time it fails because they're not ready. You have to build those foundational blocks. They have to have that control, be able to dissociate the tongue from their jaw and gain that control before you could possibly move into any kind of exercise that's going to involve bringing everything together, like suctioning, chewing, swallowing. Otherwise, you're setting them up for disaster. And once somebody gets like this negative, association with their myo program, the compliance is going to go down. So
Absolutely.
I also find when I give an exercise that they like really struggle with, I'll give them one that I know is still going to be effective, but I know that they're going to be able to do because it's psychological too. You have to take that part into consideration. So there's a lot of different things to consider when you go through a myo program, and that's why it has to be individualized.
I could not have articulated that better myself. You're the expert here. I'm just the person that's into cars, but does not work on them at this point. But
But we need
yeah,
you. We need you, which is what we're going to talk about next. Let's talk a little bit about tongue ties. So when did you start releasing tethered oral tissues?
I started releasing tethered oral tissues last year in my office. So
Okay.
I've studied it for 4 years,
Yep.
but then actually like started last year when I opened my office, About Face Collaborative in Durham. And I'm actually glad. Each person is different, but for me, I spent almost 3 full years as a student. Kind of
Mhm.
the same kind of strategy of hygiene school or dental school.
Mhm.
And then I went out and actually worked to gain the actual clinical experience.
Mhm.
A lot of people do it the opposite way, where
Right.
they take a weekend class, they start cutting, and because my first course back in 2017, there was so much distinction between these providers. I thought, let me tiptoe very lightly in this space,
Yeah.
figure it out. I want to see it from the myofunctional therapist side. I want to see it from the surgical side. I want to see it from Dr. Zagi and the ENT side, where
Mhm.
he really talks about the septum and deviated septums and all these different things. See everybody's point of view, even nutrition. I have a degree in nutrition. See it from the side of the cranial
You're
therapist.
amazing.
I've taken a couple of courses with the cranial therapist. So I wanted to see what everybody thought about tongue ties and then have the confidence to see which cases I could treat, which ones I couldn't, which patients needed more than just myo and myself, who needed to see the PT because it's a myopostural thing, and who
Right.
needed sensory integration. So because of that, I realized a lot of the people that others would have jumped into treating, they didn't need to start with me. They needed me, but a little further down their journey.
Right.
So I didn't really kind of start treating patients until last year, but I'm glad that I did it that way.
Yeah.
Didn't jump with 2 feet in. But now I'm going to start working with a bunch of infants. I just met this morning with an amazing team. Uh, they're only 2 minutes from my office, which is
Oh,
amazing.
wow.
And we were connected through the Breathe Institute, but they have OTs, PTs, SLPs,
That's
and a bunch
amazing.
of other therapists that don't come to mind right now. Myo, all housed in one place. Infant massage, everything, all in under
Wow.
one roof. Amazing. They treat children, they treat infants, they treat adults. So I'm really excited to collaborate with them. And so I'll be really, really busy really, really soon
Busier
working
than
with
you
them.
are now. I don't know if I can imagine that.
Well, clinically busier
For
than I am.
everybody, Dr. Jasmine just told me she spoke to 50 families yesterday, and she's wondering why she loses her voice.
I said, Brittany, please excuse me, my voice is recovering. I met with 53 families yesterday.
Insane.
Um, but yeah, no, I mean, it's exciting. And actually, right before this, I met with a realtor because I'm looking for a space, a studio space for my fiance away from the house. And I knew when I met this guy, he was tongue-tied. And he said, "Hey, doc, what do you do? You're a pediatric dentist, right?" And we talked for about 45 minutes about tongue ties and airway. A complete
Oh my
stranger.
gosh, that's
He's a real
amazing.
estate agent. And he said, "I think I might have that. We should probably talk again, after this." And I was thinking, you definitely have it. So I was thinking in my head. But, just, I mean, he had a tissue with him, his nose and the stuffiness. And I mean, I could see the dysfunction. He couldn't lateralize and all of that. I could see while he was talking. I was trying to look at his eyes and not at his mouth while he was speaking. But just the sheer volume of people who suffer with these conditions and have no clue keeps me motivated each day to push myself to do more and more and more and bring in other people who can help me out so that I don't have to do as much maybe a few years down the line. But
Right.
it really is a passion project. As you know, I've listened to your podcast. It's amazing. I mean, gosh, there's so many people who
Everywhere.
really need this. And every day I learn something new. Every day my mind is just blown with new information. I'm excited. I get up every day with a smile on my face, excited about what new thing is going to
That's
happen. So
amazing. So
it's
will
pretty
you be working strictly with babies then in the
fun.
upcoming months?
Right now in this season, we're just doing 0 to 2.
Okay.
I have a wait list of adults for functional frenuloplasties. I told them October, November.
Okay.
So I will get back to other age groups. But right now, since my schedule has shifted a bit, right now my Fridays are my available days for me to treat the 0 to 2 kiddos and their families. So each Friday from now until maybe the fall, we'll just work in that age group. And then hopefully I'll have some support in the traditional dental side to be able to get my full-time life back to start treating the other
Yeah.
age groups. Because as you know, as you get older and you get those customized plans, the coach in me likes to do, I think a lot of people, they have great providers and great therapists, but where the patients struggle is in accountability.
Mm-hmm.
They struggle with the consistency. At least
Right.
I did, speaking personally for sure. So what I decided is let's pick a time that people want to have a text message or a FaceTime call. And, I love Gary Vaynerchuk. I don't know if you're into him, but
Yep. Yep.
he's my alter ego. I was that way when I coached. So it's, I'm not at the therapy, I'm not a therapist and I'm not a surgeon in that moment. I'm a
Mm-hmm.
coach. So I can go, Brittany, what's up this week? Oh, well, I had an appointment with Mayo and Jimmy got sick, so we had to cancel. Okay, well, when is it? When are we? Let's do some exercises right now. Like get that accountability piece.
Yeah.
So I started piloting that a couple months ago, and it was really successful. My adult patients were really excited about having a kick in the rear call each week. And at
They
two
need
o'clock
it.
today, they need it. And at 2 o'clock today, I have a check in with a 3-year-old, and they love it too. They like to tell me about their week and what
Oh,
they
I'm
have going
sure.
on. And so I realized that people do like that community and that camaraderie outside of the office to just check in and see what's going on and give you a little tough love and support
Yep.
with, hey, you know, it didn't go the way we wanted this week, but let's dust ourselves off. And
Mm-hmm.
what's our plan to start over again? for tomorrow and get back on the horse. So I think that more than anything else is what can be missing a lot of times from programs.
Oh, for
And
sure.
so I'm excited about seeing where that goes. But definitely adults are back on the table soon because we have a wait list. And Dr. Zagi's coming to North Carolina as a part of my affiliation with the Breathe Institute. He'll be doing a little lecture
Fun.
here and doing some proctoring with me. And Dr. Pinto will be coming as well for the infants. So
Awesome.
we got a
I
lot of
know
exciting
I'm so mad because so one of the dentists that I work closely with, there's a dentist in Mass that isn't too far from us because we're in Connecticut, maybe like an hour and a half drive. And she's getting trained with Dr. Zaghi right now. And they're here to be in her office, do the procedures and whatnot. And then his lecture is Saturday night, tomorrow. And my dentist friend, she's going to have her release done. She's super excited. But I one was going to get to go, which I was super excited to meet Dr. Zaghi. Two, I was excited to hear him lecture. But I have a wedding tomorrow,
uh,
so I can't go. I'm so upset. It was supposed to be earlier, I think, and then they had to change the date. And I was like, rats! Somebody else needs to take Dr. Zaghi's course in this area.
hey, Breathe Institute, if you're listening, there's a future affiliate. They try to space us out
Yep.
so that, we're not jumbled up on the top
We
of each
need one
other.
in
But
Connecticut.
I will put the word out and we will get you someone in Connecticut. That is now my
Fantastic.
focus of the next week. We'll work
I
on
love it.
that.
I love it. So while we're still on the topic of tongue ties, let's talk a little bit about sutures versus not sutures. There's also a lot of different philosophies with providers on this and who likes them, doesn't like them. I'm sure like everything, it's patient specific. I know that Dr. Zaghi does suture a lot. So if you want to talk a little bit about your beliefs and philosophies with that.
Yeah, I mean, I have that Dr. Barry mindset on these things, I don't see a problem with no sutures if the appropriate, post work and monitoring are in place.
Yep.
We understand how wounds contract and we have a true understanding of the other pieces of this patient's puzzle.
Mhm.
And from just my training with Dr. Zaghi, understanding wound contraction and why he places sutures, at least for my adults, it's how I do things. But he's one of the people for sure that's open to learning
Mhm.
new things. So I think the jury's still out for sure. I actually have provider friends who don't place sutures, and they swear that they get amazing results. And every time I drive by their office when I'm up in Jersey, this provider in particular I'm thinking about, she's got a line out the door, so she must be doing something
Right.
right. Um, it's tricky. I'm one of those people. I'm in the middle. I'm just kind of like I see good on both sides, and even with the tools and instruments. I mean, we use a light scalpel,
Mhm.
and then I use Dr. Zagi's technique with scissors. But really, I've seen a lot of damage done with scissors. I've seen a lot of damage done with light scalpel.
Mhm.
It's as much the provider behind the tool as it is the
1000%.
tool and understanding when one tool is appropriate over the other. I get phone calls all the time about, well, are you going to do scissors or are you going to use the light scalpel? It's going to depend on the tissue thickness. It's going to depend on where they are in their training with Myo, what the goals and objectives are, what other therapies are they doing, what does their neck look like. I mean, there's 101 other factors,
Right.
and it's just a tool at the end of the day. It's how
Mhm.
we use the tool that matters. I see sutures really in that same light. And I'll say, subject to if I find out anything in the next couple months, I'll have to come back on. We
Yep.
must have an immediate episode, and I go, no, sutures only, or no, burn all the
Yep.
sutures.
Yep.
But but
No, I
my
think you're 100%. I agree with you. And that's, what I share with the patients because we have different providers over here that some do them, some don't, some use the laser, some use scissors. It's really just like you said, the skill behind the provider, their understanding of the whole body with the tongue tie and not just like, let's go and snip this tissue. Definitely the understanding of that. Definitely the pre and post-op myo. If you have a patient that is not going to be compliant with their post-op myo, then maybe placing sutures is going to be a better idea. So definitely case specific, but I always just like to ask everybody their opinion on it because I know for myofunctional therapists, they're always wanting to know, well, what's better? Like we want to give our patients the best. So we want to only work with patients that or providers that do the best. And I tell them all the time, it's their skill. Like
Yeah.
we have a doctor that he's probably about an hour away, who trained with Dr. Zaghi, I don't even know, before he started using the light scalpel. So he still uses just the scissors technique. And I mean, his results are beautiful, you
Yeah.
know? And then it's just the skill in the provider and the patient and how they're set up for pre and post op 1,000%. Um,
Yeah. I think my answer to because I have myofunctional therapists from other states who call me and ask me that same question,
yep.
is find out from your surgeon what training they've had, and people really should have like a wealth of training,
Yes.
right? So Dr. Baxter, I think we might have been talking about that off camera, but he has an amazing course, and there are others. I would shy away from someone who is really like there's just one way to do it and it's magical. I'm more inclined to have someone tell me about their failures and be
Mhm.
drawn to someone who's willing to say, hey, we used to do it this way, it didn't work that well, we kind of tested
Yeah.
this and now we're doing this. And someone who's willing to expose their flaws a little bit and be honest with you as a therapist with where their weak points are as a provider, which patients they don't see, instead of someone saying, yeah, send them over, I can treat them. Like, what's your target range? What's your comfortable zone of genius, an age group, or, with specific tongue tie, anterior, posterior. I don't love that language, but I know people do. But we each have our particular zone where we thrive. And if a surgeon is willing to be honest with a therapist and say what their true strengths are, I think that's the person that I would really align with, whether they were using sutures or no sutures, laser or no laser, someone who your patient is getting the best care. And that surgeon understands what I always tell families, which is the least important part of the process is the release. That's
Mhm.
the least important part of the process. It's about the function. It's
Mhm.
about the muscle memory that we've had for 7 years plus time in the belly, or 42 years plus time in the belly, unlearning all the things that we didn't need to know, relearning all of these new things within our face, head, and neck and body,
Mhm.
and keeping those things consistently. That's more important than the surgery, because I see specifically, I get referrals for kids who've had their tongue released 3 times, and
Mhm.
now I'm the fourth provider, or 2 times, and I'm the third provider. I see a lot more of those now, complex cases, than I do first time surgery kids. And I saw a mom yesterday that would have been so thankful to listen to you and your podcast, because her daughter had her tongue released and for speech, and the speech didn't improve. And we met yesterday about cavities, but I noticed there was a tongue tie and we started talking. And she said, wow, that makes so much sense, because, and I didn't know she had a tongue release at that point. I didn't ask, I should have, but I was doing my cavity thing and I hadn't even gotten to that part of my thought process yet. And I just like, oh, okay, assistant tongue tie. We'll get back, talk to mom about that at the end. And then
Yeah.
mom kind of cut in like, nope, let's talk about that now. She had a release, but I think from the therapist side, for all the myofunctional therapists listening, I think the patients appreciate that you're working with someone, you're collaborating with someone, and if that someone's not willing to chat with you and expose their flaws and tell you that they've taken several courses, not I took one weekend course and I'm starting to go, that's not the most ideal person.
Right.
Uh, but you know what? We have a zone of incomplete ideals, or I guess things that aren't necessarily perfect, that we have to work with, that we can make do too. But if I had a choice, I would choose a provider that not necessarily what they use, but how they're using their tools, and their philosophy would be what I would do as a myofunctional therapist. Sorry, that was a
Absolutely.
long way to butt in,
No,
but
no, no, but it's
I
so
get that
true. And
question
I'm
too.
sure there's so many, therapists that will listen to this episode that will be thankful for your answer, because it can be very confusing. Again, we always, as a hygienist, we want this like structured answer, always this. It can never be gray, never. We always want, you know what I mean? And that's one of the mind shifts that you have to make as a myofunctional therapist compared to hygienist. Yes, we deal with an array of patients as hygienists and everybody's mouth is different and so forth. But I mean, Myo is just a whole new realm when we talk about how we have to treat every patient so differently. You know what I mean? So thank you for that answer. And thank you for coming on and chatting with us. We're definitely going to have you back because I still have like a bunch of other questions on here, but I have such a busy day and one of my patients just walked in. So we do have to wrap things up.
Oh my goodness, patience first. Well, thank you for having me, and we'll chat again soon.
Yeah, we're definitely going to have to do that. Thank you so much.